Amyloidosis, pronounced amyloidosis, is a rare disease that develops when an amyloid protein builds up in organs. Organ dysfunction may result from this amyloid accumulation. The heart, kidneys, liver, spleen, neurological system, and digestive tract are some of the organs that could be impacted. Certain amyloidosis forms co-occur with other illnesses. With the therapy of the other disorders, these types might get better. Some forms of amyloidosis can result in organ failure that is fatal. Chemotherapy, which uses potent medications to treat cancer, may be used as a treatment. Other kinds of drugs can lessen the generation of amyloid and manage the symptoms. Transplants of organs or stem cells might be advantageous in some cases. Symptoms. Amyloidosis symptoms may not appear until much later in the disease's progression. Depending on which organs are impacted, symptoms may change. Amyloidosis symptoms and signs can include extreme weakness and weariness, breathing difficulty, tingling, numbness, or discomfort in the hands or feet, the legs and ankles becoming swollen, constipation or maybe bloody diarrhea, a protruding tongue that occasionally appears to have ripples on its margin. Purplish patches under the eyes and thickening or easy bruising of the skin are examples of skin alterations. Causes. There are numerous varieties of amyloidosis. Some types run in families. Others are brought on by external causes like chronic dialysis or inflammatory illnesses. Several kinds impact several organs. Others merely impact a certain area of the body. Various forms of amyloidosis include amyloidosis AL, immunoglobulin light chain amyloidosis. In wealthy nations, this form of amyloidosis is the most prevalent. Primary amyloidosis is another name for AL amyloidosis. Typically, the heart, kidneys, liver, and nerves are affected. Amyloidosis AA. Another name for this kind is secondary amyloidosis. It is typically brought on by an inflammatory condition, like rheumatoid arthritis. The kidneys, liver, and spleen are the organs most frequently impacted. Inherited amyloidosis, familial amyloidosis. The kidneys, heart, and nerves are frequently impacted by this genetic illness. It often occurs when a protein is produced abnormally by your liver. Transthyretin is the name of this protein, TTR. Untamed amyloidosis. It has also been referred to as senile systemic amyloidosis. It happens when the liver's production of the TTR protein, which is normally produced, creates amyloid for unclear reasons. Men over 70 are more likely to have wild-type amyloidosis, which frequently affects the heart. Carpal tunnel syndrome may potentially result from it. Regional amyloidosis. The prognosis for this kind of amyloidosis is frequently better than for others that affect various organ systems. Localized amyloidosis frequently affects the bladder, skin, esophagus, or lungs. A proper diagnosis is necessary to prevent therapies that impact the entire body. Risk factors. The following factors raise the risk of amyloidosis. Age. The majority of amyloidosis cases affect persons between the ages of 60 and 70. Sex. In men, amyloidosis is more prevalent. Various illnesses. The chance of developing AA amyloidosis is increased by having a chronic inflammatory or infectious condition. Family background. Certain forms of amyloidosis are inherited. Renal dialysis. Large proteins cannot usually be removed from the blood by dialysis. Abnormal proteins can accumulate in the blood of dialysis patients and eventually deposit in tissue. With more recent dialysis methods, this syndrome is less frequent. Race. African Americans appear to be more likely than other people to have a genetic mutation linked to a heart-harming form of amyloidosis. Complications. Amyloidosis can cause severe harm to the heart. The capacity of the heart to fill with blood in between heartbeats is decreased by amyloid. With each heartbeat, less blood is pumped. Breathing difficulty may result from this. Amyloidosis can lead to issues with heart rhythm if it interferes with the electrical system of the heart. Heart issues caused by amyloid can become fatal. Kidneys. The kidneys' filtering system may be harmed by amyloid. Their capacity to eliminate waste from the body is impacted by this. Kidney failure may eventually result from it. System of nerves. Pain, numbness, or tingling in the fingers and feet might be brought on by nerve injury. Amyloid can bring on spells of alternate constipation and diarrhea if it disrupts the nerves that regulate bowel movement.
For any questions, leave a comment below and don't forget to subscribe.